Hi, my name is Kafri Day, and today we're looking at the medicine of urinary tract issues, and then also the science and technology of doing surgeries without making cuts. And my guest is a urologist at the West Africa Institute for Special Surgery, WAISS, Dr. Joseph Akono. It's good to have you on GTV Breakfast.
Thank you. Thank you for having me.
Let's start by defining what urology is and what the conditions are.
Yeah. So essentially, urology covers the diseases, conditions affecting the urinary tract and the reproductive structures in the male. That's in summary.
Okay.
Yeah.
In Ghana, what are the most common urological conditions that you see in your practice?
Yeah, so most common situations would be enlarged prostate, prostate cancer, kidney cancer, kidney stones, and more rare situations where people have testicular cancer. A big chunk of urology is men's health, which is one of the things that I'm excited about working with patients here in Ghana.
Why does it excite you? Just to work on men's health?
Because I think men's health provides the fulcrum where you're able to screen and educate patients so they don't develop the conditions. Yeah, so there's a lot of medical evaluation, including screening for cholesterol levels, PSA. That's when you talk about annual exams with prostate exam to check, make sure that the person doesn't have cancer.
And what's PSA? Breaking down for me.
Prostate-specific antigen.
Okay, you're looking for something that will show whether you're at risk.
That's right, for prostate cancer.
Okay.
It's specific to the prostate.
Okay.
Yeah.
What are the early signs and warning signals that somebody may be developing a urological condition?
So it varies.
Okay.
If it's prostate related, you will have mainly urinary symptoms.
Okay.
So there will be urinary frequency, a weak stream.
What's a regular frequency for urination?
So if you think of it, the bladder is able to store about 450 to 500 ml. That's
Okay.
half a liter.
Okay, that's like a small bottle of water.
That's right.
That's what the bladder can store. Okay.
So if you consume that much, that will be one void for you to go. Yeah.
Okay.
And so from that standpoint, if based on how much you're drinking, most people on the average anywhere between 3 to 4 hours, that would be a normal frequency.
Okay.
Yeah.
And why is weak stream a sign? Weak stream is when you don't have much force for the urine coming out.
So that's a sign that your prostate, especially as we get older, may be getting enlarged. In some few cases, some people may have a stricture, meaning scar tissue that formed.
Okay.
Maybe from an old infection that they had.
Okay.
Yeah.
As men, are we all doomed to get prostate issues the older we get?
I think so. I think if you look at the data, by age 50, half men already on medication for enlarged prostate.
For real?
Yeah.
Wow.
Yeah.
You also talked about kidney stones.
That's right.
What are the signs that you may have some kidney stones?
Most common is pain. Yeah.
Where?
In your flank.
Okay, where's the flank?
Yeah. Up
Okay.
right below your
under
ribs.
my ribs? Okay.
Yeah, below your
I
ribs.
should be feeling pain there.
Yeah.
Why?
Because the kidneys are located in that region, and they drain down tubes called the ureter into your bladder. So when you have obstruction, the back up of the urine stretches the kidney and causes pain.
Okay.
And that's so when it is on your left, that means the kidney stone likely will be on that side.
So is there literally a stone in your kidney?
A stone in the kidney that's trying to pass down the tube.
And that's where the pain comes
That's
from?
where the pain comes from.
So you guys are going to melt it or what?
And so fortunately now we have all these minimally invasive ways of dealing. In the old days, they have to cut people up.
Okay.
Actually, some places in Africa, they are still doing that. But here at WAISS, we have the technology to pass a telescope up to where the stone is at and use laser.
And just zap it away.
Zap it, break it all down, and remove it.
Like Star Wars.
Yes, like Star Wars.
Is it fun zapping these things away when you're doing it?
It brings me, I'll tell you, one of the exciting things for me in urology is because of the technology and making you get to places in the body that otherwise takes a lot of work open to get to. So I enjoy that part of my job.
I can imagine, and you're helping people as well.
That's right.
Are there any risk factors or lifestyle choices that can predispose you to urological conditions?
Yes, some of them. So I think that overall, healthy living, staying in terms of what you're eating, it's very important that we consume our vegetables, minimize how much sugar and salt we take, and remain active in terms of physical activity.
Why is activity so important?
Because I think we are meant to move. That's why we have
And the legs.
and all the muscles.
Yes.
And I think we need that daily stimulation of the muscles to keep our metabolic rates staying high, and that a lot of things we consume then gets used, and that helps you maintain your body weight. So that's a very important part of staying healthy.
Can sexual activity predispose you to some urological conditions?
You know, there's been some studies that indicate that people who are not frequently engaged in sex are at higher risk of developing prostate cancer, but none of that has been consistently confirmed. Yeah, so I think that the most important thing is that you have protected sex, so you don't expose yourself to infections, because infections can then cause strictures, which is the scar tissue. And besides that, just make sure that you are hydrated, and I think the one question answered I didn't give to your question about the risk factors. Prostate cancer can run in families.
Okay, so it's a genetic thing.
Yeah, genetic thing. Yeah, so it's important that if there's a family history, you start checking your PSA sooner than later.
Okay.
Yeah.
How much water is enough water to drink in a day?
So there's a simple formula, which is half your body weight in ounces of water. And so you use not kilos, but pounds.
Okay.
So let's say
I'm saying 200 pounds.
100 ounces of water a day. That's it.
Simple.
Simple.
So weigh yourself in pounds, divided by 2,
That's it.
and drink that water.
That's it. A day.
All right.
Yeah.
I think this will work.
That's right.
All right. So when should somebody be concerned enough to want to go and visit you or any urologist to go and get things checked out? What should not be ignored?
So especially if you have urinary symptoms that I mentioned, the frequency, urgency, weak stream. Some people may even have blood in their urine. That is something that you should never sit on.
If you see blood in your urine,
you need to see the urologist,
okay,
or at least go to see your regular doctor.
Why?
Because it could mean so many things. It could be a sign of just the enlarged prostate, but the most concerning could be prostate cancer, bladder cancer, kidney cancer. And the less concerning could be also from a stone.
Yes.
Yeah, so there are so many things that can, but the fearful conditions that if not diagnosed soon could be potential problems will be kidney cancer, bladder cancer, and prostate cancer.
How about urination? That takes a lot of, you hear stories of men really straining just to release a couple of drops.
That's right. And
that's also a sign.
That's a sign, yeah, but that's usually one of the later signs that you've had a condition or symptoms going on for a long time. That's because the bladder is a muscle. So the muscle has to contract to push the urine through the prostate. So it takes time for you to get to that point.
Can the pain be so much that men don't even want to, they don't look forward to urinating? Can it be that painful?
Yes, yeah, it could be. I've had patients who will complain, say, so they want medication, they want pain medication so that they take when they have those situations.
Yeah.
The only downside of some of the pain medications, especially the narcotic pain medications, that it will put you into urinary retention.
What is urinary retention?
When you can't urinate at all.
Lord.
Yes, that happens.
But you can feel that.
You feel the urge to go, but you go to the bathroom and you're not able to urinate.
Please tell me there are solutions.
There are. So it's one of those things that you don't want to get to. But if that happens, the first thing would be to go to the hospital. They'll put in a catheter, which is like a tube that drains the bladder. And once everything is settled, there are treatments, especially if your bladder is still functioning, that we can do to undo the blockage from the prostate.
Just jumping a couple of steps ahead. I mean, can a bladder be replaced?
Yes, it can be replaced, but that takes a big surgery to do. And usually we use the intestine to reconstruct a bladder.
Okay, so you take a part of the person's intestine
and then fold it. Okay. And then we usually use it not for urinary retention. We use it for people who have bladder cancer.
Okay.
Because I do surgeries where I remove the whole bladder.
You do?
And then I have to reconstruct with the intestine to create a new bladder and hook the ureters to. Okay. And then the bladder from the intestine works a little differently. But yes, there are people who need that kind of surgery.
I'm just curious, how big is an adult bladder? Like a fist?
So if you think of it, yes, about that. Yeah. Okay. So it's like I mentioned earlier, it takes about half a liter to fill it all up. Okay. All right. Yeah, so it's about that size.
Okay.
Yeah.
All right. Now let's talk about diagnosis. So you mentioned maybe 4 or 5 different urological conditions. How do you diagnose all of them?
Yeah. So let's say the most common thing will be the prostate enlargement. We call it benign prostatic hypertrophy, BPH.
Okay.
First thing is you want to know if when the person urinates, they are emptying their bladder. So we have scanners here that they come in an ultrasound with a full bladder, and then they urinate, and then you scan first. We call it the pre-void. And then when they are done, you scan again to see how much they were able to empty out. Yeah. And so that gives you an idea if they are emptying completely or not. And then that urine that comes out, you check to make sure that they don't have an infection. So that's the first part of it. And then the final thing we do is called the cystoscope, where you pass a telescope up into the bladder to see how things look from the inside.
The telescope like the one we use to see stars?
That's right.
But a small one?
The small one.
Okay.
Yeah, I don't know. We actually have some back here that I can show you.
All right. Yeah. Okay. And you pass it through the...
Pass through the urethra.
Okay.
And then you're able to see the inside through the prostate into the bladder.
Okay.
And that gives you an idea how occlusive the prostate is.
Okay. Yeah. And then when you see what you have to do, then how do you treat for that particular condition?
Yeah, so one of the last things I do is an ultrasound. The ultrasound, which we also have back here, allows you to determine the size of the prostate. Nowadays, that's what determines the kind of treatment patients get. So for smaller prostate, now we are using laser ablation, where you use a laser probe to just ablate and vaporize the tissue.
Just zap it away?
Zap it away to create adequate channel in the prostate for the patient to urinate. Now, it takes longer when you're using the laser for a bigger prostate. So one of the things that we have now is called the bipolar urethral resection, which you cut tissue with a bipolar electric element, and you are able to resect quite a bit of tissue from the channel. And the one advantage of the bipolar is that then you're able to test the tissue that you remove for cancer as well. And then we have even newer techniques coming, which we plan to introduce here.
Also minimally invasive?
Minimally invasive, called aqua ablation, using water, pressurized water, to ablate the tissue.
Ablate means what?
To sort of remove the tissue.
Okay.
Yeah, and remove the tissue without trauma, because water doesn't cause any damage.
No.
And so that's the newest thing that we have.
But it's going to be like a jet spray, like at a car wash or something?
That's right.
Okay.
Actually, it's very pressurized water.
Okay.
Super pressure, and that's what ablates the tissue.
Okay.
So most of the delicate structures outside the area is preserved.
Okay.
Yeah.
And so that's for the enlarged prostate.
Enlarged
How
prostate.
enlarged can the prostate be? What's the biggest one you've seen?
Oh gosh. So my biggest prostate I've taken out was 350 grams. So let's put that in perspective.
Yes.
The average teenager prostate is between 15 to 20.
And then adult? That's a lot of weight. So did it affect the way the person was walking?
You would think so, but I think it's not unusual for men to adjust to their symptoms.
To the pain. Yeah, we don't want to go to the hospital.
They don't want to go to the hospital.
So we acclimatize to the whole thing.
That's right. So we just adjust to it.
Okay.
Till it becomes a big problem.
We need to change.
Yeah.
Men, we need to change.
Oh yes, yes. Education is going to be critical.
Big time.
This. Yeah.
What's the prognosis? I mean, after you've gone through all this, what's the outlook for a man who has undergone procedure to deal with an enlarged prostate?
I think that it's good so long as they show up early, which is why I mentioned earlier about men's health.
Indeed.
Men's health allows us to screen. You don't wait for the problems to be. Most people, by the time they are 50, we encourage them to see a urologist. At least have your PSA done, have your urine checked, has a full blood count done, and then metabolic profile, which checks your kidney function, and liver function and other testing. Yeah.
Okay.
And so based on the numbers, and then the complaints that you report to your urologist, that helps us guide you and then so that you can avoid some of these pitfalls.
Okay.
Yeah.
Let's move away from enlarged prostate to diagnosis and treatment of some of the other common conditions. So what will be the other common conditions?
So another thing will be the stones that we mentioned.
Kidney stones.
Kidney stones.
How do you find them and how do you deal with them?
So most of the time when they come, blood in the urine, pain, so you order a CT scan, and then that helps determine what we need to do. And a lot of this is either in the kidney or stuck in the ureter, which is the tube that drains the kidney. And then now we have the laser that we can go zap it and remove the stone.
Okay. And then people can have a normal life after?
Yep, they'll have a normal life. Actually, I did one here that had a really large stone about 6 weeks ago. And we cleaned everything out and then took the stent out because he had a lot of stone fragments. So when you break, there's going to be a lot of gravel.
Yes.
So I left the stent in for about 3 weeks.
What is a stent?
The stent is like straw, and it runs between the kidney and the bladder and allows some of the gravel to pass.
It's like a bridge, little bridge.
A little bridge, yeah. And then also it keeps the ureter patent.
Okay.
So that when you take it out, it's the lumen is more open to allow even more gravel to pass.
Okay.
Yeah.
All right.
Yeah.
So those are the kidney stones.
Those are the kidney
When it
stones.
gets to cancer, what do you do?
So
Prostate cancer.
Prostate cancer, so usually most people will present with the PSA that I mentioned earlier being high.
What is a high PSA?
So for the average population, so that's one of the things, but here in Ghana, the cutoff is 4.
Okay.
And it's everywhere in the world. But I think there are certain differences that we've not studied here in Africa. So I think that's one of the things that over time we are hoping we'll collect data to look at. But currently 4 is the cutoff for every man. And so anything above 4 is when it's a red flag. It doesn't mean you have only 30% to 40% of people would have prostate cancer with an elevated PSA.
Okay.
So we always have to consider that. But once they show up with that, the physical exam is very important.
How do they do it now? Most men are afraid of the prostate exam because
yes.
you don't want to have an idea of somebody's finger up your
That's
your
right.
anus.
Yes.
Yeah.
But you know, the thing though is 15% of people, that's how we diagnose. You feel something abnormal,
Okay.
even when they have a normal PSA. Yes.
Okay.
So that exam is very important.
Okay.
Yeah, that you combine that with the PSA.
Okay.
And so once you've identified if they have a elevated PSA and the exam is either abnormal or normal, the next step is getting an MRI to see if there are any suspicious lesions in their prostate.
What's a lesion? A cut?
No, like something that looks suspicious.
Okay.
So when you do like MRI is just like a CT scan. So this one is very specific. We call it multi-parametric MRI, focus on the prostate. And that will show us if there are lesions that could be cancer. That way you can target it with the biopsy to confirm.
So are they radiating your groin and your testicles with,
No.
with stuff?
You're just using needles.
Okay.
And then after you've done the MRI, you use an ultrasound to find the spots.
Needles?
Needles.
Will you be conscious when you're sticking needles in my groin?
We do it under local. So you have some lidocaine injection.
Okay.
So that the pathway of the needle is all numb.
And we're not feeling it?
You don't feel it.
Okay.
Yeah.
Has anybody woken up in the middle of you doing that and then...
Most people are awake when we do this.
Yeah, but has the pain worn off in the middle of you inserting a needle?
No, it does. It takes, so when we do this local, usually it's effective for 2 to 4 hours.
Thank God for that.
Yeah.
Okay.
But then it wears off, and then you feel a little sore.
So what just happened? Okay.
Yeah,
So how do you treat prostate cancer?
So various ways. So nowadays, we have various grades and stages of the disease. So if you have an early stage where it's low risk, nowadays we watch it. It's not all the prostate cancers that you have to rush to surgery. Okay. There's something we call active surveillance, but it's based on low volume, low grade disease. And then we watch it. And usually we watch it by doing 6 months checks with the PSA, and then the exam on the prostate, and then sometimes we have to repeat the MRIs. And then down the road, based on what is happening, you may need another biopsy. That is when you're on active surveillance. And then there is radiation, where they put seeds into the prostate whilst you're under anesthesia. Okay. They introduce the seeds to treat the whole prostate. That also works for lower risk prostate cancer. And then if the cancer is a little more aggressive, that's where we do radiation and surgery. And surgery can be open or laparoscopic and robotics.
What's the difference? When you say open, what?
Open, just cutting you up.
Okay.
Yeah,
Okay.
and that's what most places have their surgery, the prostate cancer treated. And one of the things here, we are doing laparoscopy now. Okay. But ultimately, we are bringing the robot to this hospital for prostate cancer.
What is laparoscopy?
Laparoscopy is when you make keyholes, and then you use a camera to look inside the person, and use small instruments through the same keyholes on either side of the body.
Like you're playing a video game, man.
Close to, but this is real life.
This is real life,
and
the wins are real.
That's right. So
where's the prostate though?
It's down the lowest part of our pelvis.
Okay.
So behind this pubic bone. So
okay.
It's right there.
Okay.
So if you look at there's a little structure back there that shows the body parts.
Okay. And that's where it is.
Yeah.
Is it true that black men are more prone to prostate issues than other men around the world?
I don't think it's necessarily true in that wise, but black men, when they do have prostate cancer, tend to be more aggressive.
Have they found out why?
It's likely related, based on the studies so far, likely related to the genetics.
Okay.
Yeah. Okay. Yeah. But yes, for every stage grade of disease in a Caucasian versus a black person, the cancer appears to be more aggressive. Okay. So when we are doing active surveillance in blacks, we want them to understand that they have to come as instructed in terms of the follow-ups, keep the appointments, so they are not waiting longer. So if anything changes, we'll catch it sooner so that they can still have...
Are the men listening? You know, we are
that
becoming stubborn.
is, yeah,
are we
that
listening?
is the thing. So that's one of the things we want to do, make sure we are educating patients that if you want to go this route, it's very important that you show up every 6 months.
Okay.
Yeah.
You've talked a lot about minimally invasive surgery. Talk to me about the benefits in terms of recovery time, pain, and just long-term outcomes.
So the big points is, first, minimal blood loss.
Okay.
Yes, and that's huge. You know, because, you know, first off, let me, before I get it, so an example, I did kidney cancer surgery here, and for about 5.5 centimeter kidney tumor, which is cancer. So about half the kidney was cancer.
Gone, yeah.
So I had to remove the whole kidney. It took 2.5 hours to do that surgery. And then when I was done, I made a small incision and took everything out. That person lost about that much blood, and then went home the following day, just on Tylenol. Didn't take pain relief. Didn't take anything else. So coming back to the advantages, less blood loss, minimal pain, and they are back to doing activities as quickly as they are able to in terms of functioning as they did before the surgery. Yeah, so those things are huge. Now, and then the other big thing is if people learn how to do that, it's going to save a lot of time loss from work and family activities. Those things are very important, yeah. And the complications rates are very low. Yeah.
Okay. Before we end and you give us some tips on how to maintain good urological health, talk to us a little bit about the West African Institute for Special Surgery, WAISS.
WAISS. So the main mission for this place is to allow experts. I'm a urologist, and I did my medical school here, so I knew the situation before I left. And I think part of the reason I'm so much into minimally invasive surgery is we don't have that here. And WAISS provides a platform for us to have all the tools, the technology, and the techniques so that we can treat people here and train as well. So the main mission, going back to the mission, is bring international collaborators, experts in urology and head and neck, which is the other part of WAISS, so that we can collaborate with our local experts, so that together we can make things urologic care better for everyone.
Okay.
And then train our future urologists.
How often do you come back to Ghana?
Currently, I'm coming for a week every other month.
Great.
Yeah.
Great stuff.
Yeah.
Yes.
Yeah.
Keep doing your stuff.
Thank you.
And before we end, please give us a couple of tips that we can apply today to maintain good urological health, and talk to us about seeking timely help.
So I think, in summary, see, the kidney is a filter. So if you talk about the urinary tract, the kidney is a filter, filters the urine, comes through the tubes called the ureter into the bladder. So first thing is, for every filtration system, you need fluid, which is water.
Yes.
So you should be drinking what, we spoke about how much we are supposed to, which is half our body weight in ounces of water. That's one. So make sure you are hydrating. Two, we need to move away from all the processed foods that we consume. So if you reduce that, then you're protecting your kidneys.
Okay.
Same with salt and sugar. We just have to limit how much, just moderation. And then we need to eat a lot of vegetables and our fruits.
Okay.
Because those are the minerals that keeps the body healthy.
Indeed.
Yeah.
And seek timely help.
Yes. And then if you notice any of the symptoms of urinary frequency or blood in the urine, urgency, or weak stream, go to your doctor. Or make an appointment with us at WAISS.
I came to the doctor. His name is Dr. Joseph Akono. He's a urologist at WAISS, the West African Institute for Special Surgery. I thank you for your time.
Thank you for having me.
And for the education.
Thank you for having me.
And that's our segment. Keep watching GTV Breakfast.